Hello, this is Dr. David Santos, and of course I would love to talk to you about facelift. It is the most important, the most valuable plastic surgery there is, in my opinion. There's nothing more concerning to people than the aging of the face, particularly the neck, the jowls, the marionette lines, the nasolabial folds. These are big concerns to so many people. It starts when we're in our late 30s, but as we get into 40s, 50s, 60s, then we see these changes in aging, these aging changes that we can see in the mirror, we can see on pictures or videos of ourselves, and we don't like it. This business here is one of the most common concerns, the neck, the jowls, and the great news is that there are things we can do in the facelift, neck lift, platysmoplasty, deep plane facelift, short flap facelift, mini facelift. All these techniques can be used to deliver the best result for our particular needs. Generally, I really love to tailor the approach for each individual because we're different: male, female, overweight, thin, sun exposure, young, old. And so tailoring is very important in my view. But the overall goal is to deliver the best that we can for the neck, to make the neck look young and to bring those jowls up, the nasolabial folds, the marionette lines, addressing these areas as best possible. And so many of my patients want a bit of the mid face, the cheeks brought up as well. So all these elements are treated in a fashion that is tailored to deliver the results that are best for your particular needs. But again, this is an important area. The face is very important. We can hide the rest of our body with heavy clothes and so forth, but we can't hide this, and this is the most important thing. So it is very, very common for my patients to desire to rejuvenate the face, particularly the neck, but the face itself. In terms of my best efforts for my patients, I try to do the limited incisions as best possible, but it's dependent upon the patient's anatomy. The techniques that I use, again, are mini lift, deep plane facelift, standard full facelift, with neck lift and platysmoplasty. All these techniques are at my disposal to deliver the best results we can, depending on the patient's individual needs and desires. And so some of our patients, for instance, just want the neck taken care of, and we'll do that. Some of our patients really want to bring up the mid face, and so we'll do that. Unfortunately, with facial plastic surgery and facelift surgery, there's a lot of negative sentiment towards facelift surgery because of what we see in Hollywood. And the truth of the matter is, the majority of patients, we don't see some of the unnatural results that we see in Hollywood. The overall goal, of course, is always natural, tight for the neck and natural for the face. And so natural is a keen and important aspect of facial rejuvenation for facelift surgery, and that's what we search for, that's what we deliver. After the healing process, and we need a good 10 days, 2 weeks for the healing to reach a decent level, we should start looking very natural at that point and going forward. And that's our result, is a natural rejuvenation result, cutting off 8, 10, 15 years, and more too if other supplemental treatments are done at the same time. Fat transfer, laser resurfacing with a CO2 fractionated laser. These things supplement as needed, again, in a tailored fashion. Look forward to talking to you about your facial rejuvenation.